Good morning, everyone. My name is Joe, and welcome to today's special session on occasion of the World Heart Day. Your heart has already beaten more than 100,000 times today, and it's the one engine that powers everything that you do: work, family, even watching this live streaming right now. But here's the truth: cardiovascular diseases are now leading cause of death worldwide. And right here in the UAE, we are seeing more and more young people, even in their 30s, suffer from heart attacks. And so on this World Heart Day, we are just asking, are we really doing enough to protect what powers us? And to help us answer that, I'm joined by Dr. Nicholas Strickling, a renowned interventional cardiologist right here in UAE. And Dr. Jan, thank you so much for agreeing to do this session with us.
Thank you. Thanks for having me. Good morning, everyone.
And so, right at the beginning to start with, I want to ask you that what it actually shocks a lot of people. We used to think heart disease was only a concern for older folks. And today we are seeing people in their 30s, mid 30s, even in their 20s actually having heart attacks. We've seen that in the UAE and even around the world. Why do you think this is happening, and how common is it really?
Yeah, Joe, you're absolutely right. So this is a shocking situation because decades ago, heart attacks were mostly seen in an older population, like 60s, 70s. But for now, especially here in places like UAE, we're seeing them in people as young as their 20s and 30s, as you said already. If you ask me why, so I think it's a mix of different factors. Rising obesity, diabetes in younger ages, high stress level, even on the streets, in traffic, and in your job, smoking, lifestyle habits, and for example, diets in high processed food. And by adding, for example, genetics and ethnicity into this mix, becomes obvious and that there is the risk of heart attacks even in younger population. And when we follow recent studies, nearly 1 of 5 heart attacks happens in patients with what are under 40 years here in Middle East. So that's nearly 20%.
Wow, that's an alarming figure.
Mhm.
Wow. So just because someone looks healthy doesn't mean they're safe inside.
Exactly.
Yeah. So let's talk about the daily life here. Yeah. Many of us work long desk jobs and drive everywhere instead of walking. And at the end of the day, we end it with fast food, just because maybe it's convenient. So which of these habits is the most dangerous for the heart per se? And what kind of small changes can actually make a bigger difference?
Yeah, very good question. So I think each of those habits hurts our heart, but for me, it's sitting for long hours and is most probably the most important silent killer. So sitting slows down your metabolism, it worsens your blood sugar and cholesterol control, and it rises your blood pressure. So, but the good news is even small changes, they really work. So for example, taking the stairs instead of the elevator, walking after meals for 10 minutes with your colleague discussing something, stand up every hour at work, and swap please swap some fast food meals with something healthy and homemade. It's something on time you need to invest, but at the end it will extend your lifetime. So it's not about perfection, but it is about consistency.
Absolutely,
Yeah.
absolutely. And then on World Heart Day, people would love to know what's the one thing they should start doing today if they want to protect their heart power.
So if I had to pick one thing, it is definitely daily movement. So even like 30 minutes of walking can cut down your heart risk dramatically. So you don't need to go to the gym. So, but you need to get in habit. And maybe for this October fitness challenge, start to try to reach 10,000 steps a day. And after this, you will notice you're feeling much more energized and powerful.
Absolutely, absolutely. And then that's something which even I have I have practiced it for a long time, and I always advocate that it's movement which really matters. It's not really about hitting the gym or, like building huge muscles and stuff like that. It's just something which is sustainable, like you said, getting up, from the chair every hour. These kind of small movements would definitely bring in a larger impact overall in the longer run.
Exactly.
Great. And Dr. Jan, as an interventional cardiologist, I mean, you're often called when there is crisis. So that crisis point is what triggers, a call to you. At
Yeah.
what stage does someone typically end up, needing a procedure like stent or angioplasty, and how can people avoid reaching at that stage?
Yeah, so people usually end up needing a stent when their coronary arteries are severely blocked and the blood flow to the heart muscle is compromised. So, but I don't want to see this patient in my cath lab. So maybe we can perform, and we met in regular screenings, checkups, controlling your blood pressure, regulating your blood pressure and cholesterol levels, checking if there is any risk for high blood sugar. I advise my patient to quit smoking, even quit vaping, and staying active, as we already said. And all these factors, by reducing all these risk factors, we can prevent 70 or 80% of these cases. So with my stents in my cath lab, I save lives, but with the prevention I can even save more. So this is something I pledge for. Do your preventive checkups.
Absolutely. All right. Great. So now there's another thing that people really worry about, which is cost, of course. And then treatments can be life-saving, but also expensive. So how important is it to think about a certain health insurance that, which also as a part of protecting your heart?
Yeah, it's extremely important. So treatment for heart disease is life-saving in some cases, as I already said. It's expensive, especially when it's an emergency procedure. So that's why health insurance is not only like a financial tool. It's more like a protection for your future and for your loved ones. You don't want to leave them in debt. So having, for example, preventive coverage, what ensures you can have access to, for example, annual checkups or screenings, medication and early care, this can even prevent that we met in a crisis like a heart attack.
Absolutely. I mean, it makes a lot of sense because, like you said, preventive coverage. So prevention is better than cure, as they say, right? So it's always better to be prepared. And like you mentioned about the family not being in debt, obviously, the family would do all in. They would go all out to take care of someone who is not well. They will spend all the money, and I've seen this happening around me, which really puts them in a very deep financial stress situation.
Yeah.
But that could be avoided if the insurances are taken at the right time, the right age. Earlier the better. I mean, of course, because you're healthier, so the premiums are lower. And what can be better than Policybazaar.ae as a platform for comparing and securing health insurance, especially with preventive coverage. So there are plenty of options out there. People can just type it in, go there, compare, and see which one suits them based on their age, based on what they're looking for, whether it's an existing condition or whether it's not, whether you're super healthy right now, but a sort of prevention for future and a cover which takes care of a pocket as well, not just health. So yeah, and here in the UAE, Dr. Jan, we often see high rates of obesity, diabetes, like you mentioned earlier, and even smoking in the younger population. And so how do these risk factors connect with cardiovascular disease? And then what can people do specifically about this to be alert about?
Yeah, so you're speaking about diabetes, obesity, and smoking. What is like the triple threat for heart health? And not only in UAE, it's worldwide. So diabetes, for example, it damages all of your blood vessel when it's not well controlled. So we need to speak about monitoring your HbA1c when you have diabetes. It can damage your blood vessels. It can damage your nerve structures. So obesity, it rises your blood pressure and your cholesterol levels. So both have an impact on early calcification to vessels. Smoking as well, it accelerates artery damage. And when all these factors again hit young people all together, this hurts your heart and develops an heart disease even 1 or 2 or 3 decades earlier than usual. So this is a change we see here and worldwide. So if you have one or even more of these mentioned risk factors, you need to be extra careful with lifestyle and regular checkups.
Understood. Understood. Well, many of us, we have this habit. We only go to the doctor when there is, something that we feel is wrong within ourselves, or when there is an indicator. Yeah. But when it comes to the heart, how important are the regular heart checkups or screenings, even if we feel completely fine within? What are those silent warning signs that most people ignore until it is too late?
Yeah, you're totally right. So what is extremely important is our heart is very tricky. So it can be severely diseased without any obvious or like chest pain symptoms. So that's why regular heart checkups are essential. And again, get your blood pressure checked, get your cholesterol checked, get your fasting blood sugar checked, and do a simple ECG to check your rhythm. So it can reveal some risks early and in an early stage to get it treated as soon as possible. So silent warning signs that are definitely often ignored are, for example, fatigue,
Mm,
shortness of breath when you climb the stairs,
mm,
upper abdominal pain, what is often misunderstood as indigestion, or pain in the jaw or in the back. So these, for me as a cardiologist, are red flags, but are mostly ignored by the patients. So this is something we need to educate the patient to keep these symptoms very, 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 very serious.
wow. I would like to just go over those points again. You mentioned certain commonly ignored pains or indicators, or either, let's say, over just the upper abdominal pain, which is, misconstrued as a indigestion or gas or something like that.
Yeah, exactly.
And then we have shortness of breath when we are climbing the stairs. That's one of the
Mhm.
points you mentioned. Fatigue, or like feeling tired, even though you've not really worked out much or you've not done anything strenuous, but you're still feeling tired. So that's also maybe a little indicator there. You said something about a pain at the back of the ear. Could you maybe elaborate a little bit more on that? Because it could be a tooth-related pain, right? It could be something neck related. How do we know?
Yeah. So, this typical heart attack symptom is left-sided chest pain, what radiates to the left arm. So this is like the typical
Yeah.
textbook finding. But even there are some radiation or is some radiation of pain to the back and to the neck and jaw. And this is because the pain is radiated due to different type of nervous structures. So we do even see this in women or in patients with diabetes, because there is a different leading of the pain, and the pain is like rated differently in this kind of patients. So we call it an atypical chest pain or
Hmm.
an atypical pain, but we know that it depends also on the location of the obstruction or the occlusion of the vessel. So when it's affecting the right coronary artery or the left coronary artery, the pain is different because the location of the clot, for example, the clot in your coronary artery is different. So all this have an impact on how pain presents.
Understood. Understood. Makes a lot of sense. So these kind of triggers can't be ignored. We definitely have to take a look at them, and maybe get it checked. That what is it exactly? Because what is it? What is the reason, underlying reason for it? All right, interesting. Now, apart from these, I've also seen that people who, let's say, who don't have any visible issues in the body, they don't have any history of anything which is heart related, let's say, in the family, the parents are fit and fine. They go to the gym regularly, or at least they keep themselves active, or they track their step counts. People who are generally considered healthy in today's circumstances, but they say, oh well, I have one or two vices, oh, I
Mm.
smoke sometime, or I take alcohol sometime. Does this also have an impact, or can that be offset? It's just from the perspective of what is better, overall, and what is sustainable.
Yeah. So, get yourself checked is the one thing. Do some alcohol, smoking in moderation or occasionally, what is acceptable. But, we don't want perfection. Yeah. We want something like sustainability. We want something to be aware of your risks. And for example, when there is a normal cholesterol level seen, but there is a high risk in your family for heart attacks, for example,
Mm.
we do even discover that there is more than the LDL. You know about the LDL, it's the bad cholesterol. So even when
Yes.
your bad cholesterol is in a good or borderline level, there are some new like kids on the block, and we are checking for what is a true sign that your cholesterol is dysregulated by genetic reason, what is called lipoprotein little a. So I
Mm.
pledge for digging deeper in these kind of patients, and when there is a genetic background for an
Mm.
early heart attack, or and even when you have this genetic risk, what is a thing we cannot treat. So I need to treat the five treatable risk. What is avoid smoking, keep your blood pressure checked, avoid high lipids, avoid obesity, and avoid diabetes. So these are the five I can treat, and the sixth CV risk is genetics. So when there is a strong background for genetic risk, we need to keep these five very, very serious and treat them more aggressively. And dig, for example, in the area of hyperlipidemia, what is high cholesterol, dig a little
Mm.
bit deeper if there is a genetic risk as well, because this will have an impact on the LDL level we want to reach. So our goal for a normal patient is 100, below 100. But when you have an elevated genetic risk, it will be below 70 or even below 50 or 55. So this will have an impact. And just by checking LDL, you are thinking I'm fine, but when you have a genetic background, we need to search for even more parameters.
So you mentioned about the LDL, but what about the HDL? What if that is showing low?
Yeah. So we know the HDL is the protective one, and the LDL is the bad one,
That-
what can cause discalcification. And we often see that this dysregulation. So LDL, bad one is high, HDL, the good one is low. So the function of the HDL is bringing the bad cholesterol out of the vessel, so it cannot harm the vessel. So but we know when you're exercising, when you have a healthy diet, you will change this. So HDL will
Mm.
increase and LDL will be lowered. When
Wow.
I see high levels in cholesterol, the first thing is not to prescribe any medication like a statin. So the first thing is lifestyle change for 3 or 6 months, depends on the level
Mm.
and
Mm.
depends on the patient as well. So, but when we reach levels of 200 in first sight, you will not reach the goal we will set, or what is set by the guidelines of American and European guidelines for cardiology. So this is something depends on the level within first visit. If we can try lifestyle change, if it's like 120, it is something we can definitely where we can definitely reach levels below 100. But in some cases, when it's very, very high, we need to start treatment very early. And in population, there is a fear of taking this cholesterol lowering medication, what is called statin. The fear is side effect. The fear is getting muscle cramps or this muscle fatigue. But
Mm.
when you follow the guidelines, it's the only opportunity to reduce cardiovascular events. And the risk of having side effects in this medication is only 1% with the newest generation statins. So this is something what is not justified to take any supplements, to take any like Chinese herbs, to reduce your cholesterol, because you will not lower you will lower your cholesterol in some like percentage, like 5-10, but in some cases we need to reduce it by 50%, and this is not possible by eating red rice and taking shilajit or ashwagandha. So this will have an impact. Or
Yes, absolutely. Absolutely. No, it makes a perfect sense. And like you said, that when the levels are, let's say, slightly borderline or a little above, you don't prescribe medicines as your first approach, which is so good, because you're giving the chance for the patient, for the person to practice lifestyle changes, dietary changes per se, which can have a longer, better results, and can reverse those conditions and bring in those abnormal ranges to somewhat, a better range, or somewhat better. Good. And I think this really should be motivating to people who are watching this. It definitely is motivating to me, because I believe that, at least for me, seeing the people around me, and seeing my parents, they're aged, but they're keeping healthy, touch wood. But then we always want to stay fit, and prevention is better than cure is something which has been drilled into my system so well, that even at this age, when I've crossed 40, I want to stay fit. I want to stay fit and stay as young as I can, avoid all the things that is hampering us. And of course, being mobile, moving as much as we can. This is something which I practice, and it makes perfect sense. I have a very interesting segment for you, which is rapid fire. So I'm going to ask you a few questions, and you could answer them in just a word or a short answer. And right after that, we would be taking up these audience questions, which are pouring in right now. Everyone seems to be concerned about their heart health, and they don't want to miss the chance to talk to Dr. Jain.
Okay,
So I'm going to take the questions after the rapid fire. So let them keep piling up. So the first question, are you ready?
Yeah, I'm ready. Start.
Okay, always ready. Yes. Okay, so let's do the first question, which is morning walk or evening walk, which is better for heart?
Morning walk, in my opinion. So it will set your metabolism and blood pressure right for the day.
Perfect. So you set the tone for the day. Okay.
Yes, exactly.
One food which more people in the world should eat regularly for good heart health.
Okay, avoid fast food and eat more oily fish like salmon and tuna. It contains this omega-3. It will have an impact on cholesterol, triglycerides, and your immune system.
Wow, there's a question that has come in actually connected to this. I will come to this, but first, the third question that we have for you is: what's more damaging long term, lack of sleep or lack of exercise?
Ooh. Okay, we are already talking about movement, so this is something I would definitely recommend. But lack of sleep, for example, in patients who are snoring, we see that it will have a huge impact on blood pressure. So lack of sleep, it disrupts your hormone levels, blood pressure, raises your blood pressure, and increases your overall heart risk. Lack of sleep.
I think sleep is something which is quite underrated by a
Yeah.
lot of people, and now there's an awareness which is coming in gradually, where people are looking at, okay, I should sleep at least 7 to 8 hours, and I should sleep peacefully, and dimming down the lights and all that. So I can see this movement happening around me. So I can see it is, and then of course we practice that.
This is about the newer devices we have. So when you wear a Whoop, for example, it tells you definitely what is your range, what is your hours of sleep,
Yes.
how deep is your sleep. And even there's this discussion for screen time before you go to bedtime, before you go to bed. So we all use our smartphone in our bed, but better to avoid this, because your
True.
thoughts are still in this topic. And maybe reduce it by at least half or even 1 hour before you plan to sleep.
Agreed. It's to have that proper deep restorative sleep, right? There's a word to it, right? The SW, is it slow wave sleep or something?
Yeah, exactly. Like delta waves. Yeah, and
Yes.
so this will have an impact. Yeah.
Absolutely. Great. So sleep well, everyone who's watching this, and you sleep deep and let your body be restored. That's why it's called restorative sleep, right? So, yeah, I have one more question for you.
Mhm.
The one yearly test you would never skip if you care about your heart.
I think it's a blood test. What contains fasting blood sugar and your cholesterol levels.
Okay. Okay.
Yeah.
So checking blood sugar and cholesterol levels,
Yeah.
absolutely mandatory.
Mhm.
Is there anything else as a test which is specifically for the heart and not the blood test? Something else which
Yeah,
can be
just
some.
check your blood pressure. It's that easy. It's available everywhere. And just check your blood pressure as well. So when you do the blood test, let the nurse check the blood pressure if it's in
Yes.
well controlled. And the levels should be below 120/80.
Yeah, so it's something which is very common. I mean, every time we go for a normal consultation, even at any clinic,
Mhm.
just for a fever or a flu, the nurse is actually checking the blood pressure, and
Yeah.
they even ask, "Your blood pressure seems to be high a little today." So all those small things that we're doing are actually going to help us if we keep a track of it,
Mhm.
and being aware, I think, is very very important. All right, so thank you very much, Dr. Jen, for the rapid fire answers. And now we've got the audience questions, which I would like to take up because there are many questions coming in.
Okay.
And the first question that someone has asked here is, most of us imagine a heart attack as a dramatic chest pain and then just like collapsing. I mean, this is how we have seen it in movies and in different things, places in life. But are there silent warning signs we should be paying attention to, the kind that often get ignored until it's too late?
Yeah, so definitely it's not always this dramatic situation in ER where I see the patient with this crushing chest pain. In some cases, is the symptoms are, as I already said, breathlessness, shortness of breath, nausea, this upper abdominal pain, and not a chest pain in women and in patient with diabetes. Fatigue, extreme fatigue without any workout. These are the true warning signs or early signs, and are often ignored by the patient for a long time period.
Okay. I hope that clarifies that. So the next question that I have is that how much fish oil capsules
Mm.
help in keep making the heart healthy or to lower the cholesterol?
Yeah. Fish oil contains omega-3, and omega-3 has an impact on cholesterol, has an impact on triglycerides, and has an impact on your immune system. And there are just recently the newest European guidelines regarding hyperlipidemia. And when we follow these guidelines, the omega-3 intake is mandatory in patient with high triglycerides, or even in patient with mixed hyperlipidemia, what is called high cholesterol levels and high triglyceride. So um, there it is like 2 capsules a day.
Two
And
capsules a day. Okay. All
and
right.
even it is has a higher rate in recommendation than the typical and old treatment for triglycerides, what is fibrates. Yeah.
Absolutely. Okay. And then is there a particular timing or is there a certain way that it should be eaten on empty stomach or better with food?
Mhm.
Something of that sort?
Yeah, so this depends a little bit on the medicine you're taking. For fish oil capsules, it's fast food, and you can take one in the morning, one in the evening.
Got it. And then
Yeah.
I think from my own experience, I prefer to take it with the food
Mhm.
because it sort of avoids the breath which
Yes.
which comes out. There's one interesting question which has come up that there were calcium deposits found around the heart arteries in an HRCT.
Mhm.
What needs to be done? Just lifestyle change suffices or some sort of medication?
Yeah. So, the problem of calcium is, or there are two different CTs available. So this sounds like a calcium scoring CT. And the problem of this CT form is it will show us the calcium level, but it is hard to see if this calcium is inside the vessel, what causes an obstruction of the vessel, or is it just in the wall of the vessel or around and without causing any obstruction. So, in my opinion, this just calcium scoring should be in addition to an angiography, where in this CT scan contrast is added, where we can clearly see does a calcification cause any blockage. So, but even when there is a calcification, we need to check cholesterol levels. We need to check blood pressure. We need to check even this LPA. So this is this genetic, the genetic reason for high cholesterol, and we need to check the fasting blood sugar and HbA1c to see if and we can treat or reduce any risk in this situation. Eat healthy, avoid smoking.
Got it. Got it. Okay. I hope that that's a very important aspect of the test and the way you can look at it. But does it also mean that only lifestyle change won't bring in, or there is a medication really required since the deposits are already found? Just
Yeah,
to dig
so
into it.
this is something we cannot remove. This will stay. Yeah,
Okay.
this will stay, but we need to avoid that it will build up more and more. So when you have a finding of a high calcium score, what is, for example, a rate over 400, this is like combined with the high risk that you are on the risk for a heart attack. It depends on the amount, but we definitely need to avoid that it will build up over time even more.
All right. All right. Thanks. Thanks for clarifying that. Okay. And the next question that I have here is that given a family history of health issues predominantly affecting males, what
Mhm.
specific preventive measures or health screenings should the females in the family consider?
So, it is not only affecting males, it will affect females in the same range. So we need to check again, like the basic parameters: cholesterol, blood sugar, and go dig a little bit deeper. Just not only check this LDL because when there is this strong genetic risk for the males, it is in some cases even in women, and therefore get all these parameters checked even when like women are less affected than males in this family setting.
Understood.
Yeah.
So whether you're female or a male, both cases, the checkups, regular screenings are absolutely important. More
Yeah.
so with the family history,
Yeah.
like you
Yeah.
mentioned.
Yeah.
Okay, there's another question from an expecting mother. I'm expecting a baby soon, but since
Mhm.
I'm over 30 years, I'm scared if my heart health is okay or not. I frequently get palpitations and high blood pressure. What should
Mhm.
I keep in mind for being extra precautious or careful during my pregnancy?
Yeah. Okay. So high blood pressure in pregnancy is a red flag as well. We know there is the slightly elevated risk for the baby. So even when your blood pressure is not well controlled, you need to see your OB/GYN or a cardiologist to see if we need to start a medication, because we know there is a pregnancy or because of the hormones related hypertension, what is only patent in this pregnancy. But we need to avoid that it reaches levels what put the baby under risk, and even for delivery, this creates a risk. So we need to get the blood pressure controlled. Palpitations, palpitations are the feeling of racing heartbeats, strong heartbeats, skipped heartbeats, and this feeling needs to be like monitored. So there are so many different types of palpitation, and most of them are stress related or are like situative. but there are even some arrhythmias what needs a specific treatment. In palpitation patient, I treat them with an Holter ECG, what is an attachment of an ECG, to try to detect what kind of arrhythmia it is.
Okay, okay. The next question is connected to this, which is that I keep getting the warnings from the from the watch, which shows the warnings. And what could be the reason for this? It says irregular heartbeat.
Yeah, okay. So the newest models of your Apple Watch have the opportunity to take an ECG by yourself. So in this situation, even when you have symptoms like skipped heartbeats or irregular heartbeat, what is the device showing? Please take an ECG and forward this to your cardiologist and ask him if he can interpret your ECG, because the quality of the ECG is not bad. And for me as a cardiologist, I see a patient and it's so hard to detect this palpitation because it happens once or twice in a week. And when I attach this Holter for 24 hours, I will see nothing. So you wear your device like 24/7 or only for charging, you take it off. And when you have the alert of irregular heartbeat, take an ECG in this situation and forward to your cardiologist to try to detect what is the reason, because irregular heartbeat is sometimes a form of arrhythmia, what is called atrial fibrillation. And atrial fibrillation can build up clots to our hearts, and these clots can be sent via our bloodstream to our brain and cause a stroke. So when there's an alert for irregular heartbeat, keep it very serious, try to catch it with an ECG, and try to rule out atrial fibrillation.
Okay. And if there is a possibility of atrial fibrillation, is there a medication for it, or is it
Yeah,
again a
exactly.
lifestyle changes or whatever?
Yeah, so it depends on the age of the patient. It depends on other diseases the patient already has. And then there's a recommendation for an anticoagulant treatment. So to make the blood even thinner and to avoid building up clots inside your heart.
Right. Yeah, yeah, yeah. Wow, interesting. Now, in the UAE, we often, stay up pretty late and eat heavy dinners. How much does meal timing really affect heart health?
Yeah, so this is very important because eating very late and then a heavy meal puts so much stress to our heart and to our metabolism, and it rises your blood pressure and your blood sugar as well. And this for the nighttime where you want to relax, you want to have this restorative sleep. And I recommend to finish your dinner at least 2 or 3 hours before you plan to go to bed.
Understood, understood. And well, how about this? Suggest some dietary changes that you would swear by for a
Mhm.
good heart health.
Yeah. Reduce red meat. So red meat contains a lot of bad cholesterol. Um, Eggs, for example, are like in the past, it was recommended in high cholesterol to avoid eggs completely. For now, it is like 4 or 5 in a week, but not an egg every day. Eat healthy. Eating healthy means that you have an protein intake. What can be avocado? What can be chicken? What can be rice or carbohydrates? And so you need like lean meals, lean cuts. So this, and avoid this fast food. Sure, you can have a cheat day in the week, yeah, to have a pizza, but you need to keep in mind that all this will have an impact. And please don't order every evening. So this is what I see in my community. It's like you remember Charlie and the Chocolate Factory. So when they are delivering this news that you can join the factory. So in my community, when I go out in the evening, I see all these delivery drivers catching every house. So everyone is doing is doing this. Yeah. So try to get an homemade healthy meal, and I hope so that they only deliver the ingredients for the food what is done homemade, but I don't think so. Yeah.
Yeah, great. Well, energy drinks are really popular here. I mean, especially among the young professional students. But how risky are they for heart per se?
Yeah, so I have a lot of young patients where I need to create awareness that energy drinks, caffeine, and like in addition to stress level, causes so much like arrhythmias or palpitation, race feeling of racing heartbeat in this patient. And I ask, how many cans of Red Bull are you drinking a day? And the answer is 4 or 5, and it's something I cannot believe, to be honest. Yeah, so because this will definitely have an impact on your heart health. So this is something better to avoid, because I as a cardiologist, I see like 5 or 10 patients a week. Yeah, and even like in their 20s, and they are not aware that this will have an impact, and then they reach out to the cardiologist because they have these palpitations. And for me, it's easy: skip or discontinue this energy drink, because this is the true reason for this.
Understood. Understood. Well, I think there are so many questions that people would still have and they're coming in, but I encourage everyone to watch this podcast, this space, and of course, keep in touch with your cardiologist. Do your checkups. And Dr. Jan, finally, if there is a message that you would like to leave our viewers with on this World Heart Day, what would it be?
Um, okay, so my message is quite simple. Your heart, it doesn't fail over the night. It fails because of years of neglect, and small daily changes like moving more, eating healthier and better, checking your heart health regularly by annual checkups. It can give you even a decade or even more of strong heart power. So protect your heart today on World Heart Day, and start with it today so it can protect you tomorrow.
Wow. I love the statement you just made that you take care of your heart today. It can even give you maybe a decade more of good heart health.
Yeah.
Amazing. So motivating. I'm inspired. And I really hope the people who are watching this, they today when they go to office, they start movements, they start taking care of these
Very
things
good.
and not just be sedentary. Yeah. Well, thank you so much, Dr. Jan. Appreciate you taking time. And this really means a lot. And out of your busy schedule, you sharing your insights for those people who may not know about this or who may have never thought about this without spending a single penny. They are actually getting to hear these insights from you, a well-known interventional cardiologist in the UAE. And also, thank you everyone who's watching this. Remember, your heart is what powers everything in your life. So protect it. And if you want to protect both your heart and your finances, don't forget to compare the comprehensive health insurance plans available on Policybazaar.ae. And that's it. Take care, stay strong, and keep your heart safe. Lovely.
Perfect.